So let me, Todd, I'll open this up with you, and then let's have a conversation for a few moments about what you're seeing in terms of the use of technology in our industry, what opportunities we've got still to improve and embrace new ways of doing business.
Well, just as a disclaimer, before we start, I know how to email, so I'm not a tech. I'm not a technology or techie. Fortunately, I have a couple sons that are in the business with us, which we're very blessed to be able to work with, and they are both very technologically orientated. Just as a backup, 5 years ago, we probably made some decisions, and we did it based on the fact that we're developers, owners, and operators, and so one of the things we're always doing is trying to seek financing and financial partners. One of the things we found was financial partners were looking very closely at how we were managing our business activities. And so we, on purpose, did go out and really got involved in products that were web-based operating platforms and web-based procurement platforms. And what we're being told today by some of the lenders, again, that we were talking to 5 years ago, is that, gee, you know, you guys look like a company 5 times your size. As I mentioned before, we're just a dozen communities, so we're a small company. But that plays, and so I guess what I'm trying to share is that technology in many formats is going to be so important for us in our industry as we're being evaluated by folks who are possibly going to be lending us money to build and grow, renovate, repurpose, refresh our communities. And so that's just a little bit of an aside, but that's where we're kind of going down that road and constantly looking at what is that technology, whether it's that nurse call system that not only can find you if you're in your room, but find you and know who you are if you're in another part of the building or a different corridor or a different room. So that technology is coming, it's out there, and we're trying to take advantage of it. The community we're developing right now is a 150-unit community, as I mentioned before, in Wisconsin, and I'm amazed at the technology that's going into the firewalls and just all the Cisco-powered network system that we've got in there. It boggles my mind. And I agree with you, Pat. When I walk through the halls downstairs, it's amazing what is being sold. So it's just a little backdrop on what we've been trying to do. So.
Okay. Any other thoughts on technology?
Yeah, we're experimenting with the GE Quiet Care that is a wireless sensor system that monitors and learns resident behaviors. So we put that in one community, and where we actually converted some independent apartments in a CCRC to assisted living, and we really don't have, and many of them have memory issues, and so we can't have a secured wing because of the construction type in the building. So we found it to be a really useful adjunct to our staff, and it wasn't anything that we required the families to purchase, but every resident in the wing has bought the system, and we're in the very early stages of it so far, but it has helped us identify some things probably earlier than we might have. We're in the process now of rolling out iPads for all of our health services directors so that when they go out in the community to do their assessments, they can enter the assessment right into our care planning software there and not have to do it manually and then come back and input it into the system at the community. And we're in the midst now. We actually have, we're in the middle of a strategic plan, and so we actually have a guy staffing that who's spending a great deal of time looking at what technologies are out there. And I think in large measure, I mean, the iPads definitely help staff efficiency, but in large measure, I think we're looking mostly at things that really have the opportunity to improve the quality of care, not so much to save us money on the expense side.
Yeah. I'm chuckling because one of our senior vice presidents said to me, I got my new iPad last week, and we were looking at it yesterday, and she was chuckling with me yesterday. She said, I've got to get these in the hands of the CRDs, our community relations directors, because of the ease of having a virtual tour when they're out there, and also the HCDs, because I could do the assessment on site in the family, and I don't, our nurses, when they go out and visit families, so we're going through the same experience.
Our nurses were very excited about it.
Yeah. We have in all of our skilled buildings, we put in 3 years ago, I'm not giving an advertisement for this particular vendor, but it's a great product, the Care Tracker, which is the wall kiosk flat screen where you touch it and it drives. The ADLs are instantaneously entered into the record, so you don't have documentation at the end of an 8-hour day when memories fade or people. I've never seen this happen, but they tell me they might copy yesterday's notes.
You think?
Yeah. And
that happened to you too?
Never happened in our company,
Yeah,
probably.
yeah.
You know, anyway.
I heard about it.
You heard
someplace
about it
else.
somewhere, yeah. And all the operators are chuckling. But we're also looking at that in our assisted too, and I hope over the next 12 months we'll have those in the hallways of every assisted, because you get a real-time reflection of what the work is, and it just frankly, it makes a more productive workforce and less paperwork, and frankly, more, one of the things we're struggling with in the liability side of things is, the old paradigm in assisted living was documentation by exception. Well, you can't take care of a higher acuity resident and document by exception, and don't write all that down, regulators, if you're out there. But so trying to figure out how to use technology to improve that whole process is a huge issue for all of us, I think. So.
I think it's amazing when the regulators come into our communities now, and I'm sure everybody's experiencing this. They spend a tremendous time on documentation. And it always amazes us that they don't look around to see what's really happening in the community or make any judgment about the quality of care or the commitment or the systems, but basically go down checklist on every single piece of documentation. And so clearly our caregivers and leaders in the communities are spending a lot of time on that, and I think we've got to find ways to make that, to not neglect what we need to be doing, which is providing patient care rather than documenting the care.
Okay. We've got a few more minutes before we take questions. I'm going to skip one here. Let's cover this quickly to see if anybody has any thoughts on this. I don't think any of us have good visibility yet on where it's all going to end up. 2014, we've got a law that the Patient Protection Act will have a mandate that requires every individual in the United States to have health insurance. That's a broad overstatement, but that's part of the health care reform statute that we passed, the country passed, and we've been debating vigorously now for a couple of years. What are you all seeing in your organization in terms of the scope of benefits? Are you beginning to prepare for this issue of state exchanges, and there's some penalties under the federal law for certain numbers of your employees who may not be able to access your own benefits package, but now a couple of years from now will be mandated to go get their own health insurance, just as folks are required by law to have automobile insurance. So how are you beginning to think about re-engineering your benefit programs for your workforce and to deal with this issue that's coming? And I know there's a huge national debate. A lot of people are reform, repeal, blah, blah, all that sort of stuff. But the reality of it is we've got a law on the books that we're going to have to deal with at least and begin planning for over the next couple of years. Any thoughts on this? Marilyn, can I start with you?
Sure.
Okay.
Yeah, health and wellness is an issue that we're really passionate about at our company. And so we have tried to take a multi-year strategic approach to our benefits programs. And so we actually we're self-insured, and we have two plans. So we have a low premium, lower benefit plan and higher deductibles, and then a premium plan that's more expensive, but of course has richer benefits and lower copays and deductibles. And so we have stepped back and said, what can we do to incent more proactive, preventive care and get people to have greater knowledge about their health issues? And so we elected grandfathered status under the healthcare reform law because we have a pretty rich benefit program, but we of course had to add things like dependent care for people, kids up to 26 and so forth. And we really saw very negligible increases. Our rates of increase have been 0 to 7.5% over the last 4 years, each of the last 4 years. So, but what we did was we said, if you want to be eligible for our premium plan in 2012, During 2011, you and your spouse must get a physical, for which we have waived the copay, so there's no cost at all to the employee or their spouse to get a physical. You must get your age-appropriate screenings, and we've also waived the copays for those. And you also have to go online and complete a personal health profile. And in order to do that, which is completely confidential and all the data goes to a third party, but the idea is that by completing that profile, or in order to complete it, the associate has got to know their cholesterol, their blood pressure, their glucose, their BMI. And the theory in healthcare, of course, is that knowledge makes you, much more likely to take those preventive measures and improve your health. So we're very excited about that and the potential benefit that will have long term. And then we also have recently hired, just several months ago, a wellness manager, and she's a master's in public health, and her job is really twofold. One is to be out with all of our associates. She's completely associate-focused, not resident-focused, and to develop wellness programs in each of our communities, identifying someone in that community to act as the real leader and champion for wellness in their community, as well as in our home office. And then she's also responsible for being very data-focused and looking at the data and tracking results on our associate population. We spend $9 million a year on health insurance, and so her job is to manage that budget for us for the foreseeable future and really make plan recommendations that can help us control our costs as we're required to provide greater coverage. So we're very excited about it. I'm excited to see what it'll produce.
Is there a surcharge for smoking? Are you doing anything like that?
No, we're really not doing penalties. We're more about incentives.
Are you doing any cash rewards or cash incentives?
Yeah, we've done that
behavior?
for smoking cessation, and we also have, our communities all have a budget, a wellness budget that we fund out of our self-funding reserves. So they have money they can use. One community, for example, has started a community-wide Weight Watchers program, and because a lot of the associates couldn't afford the upfront, I think you have to pay 3 months upfront for Weight Watchers. So they worked with our HR department to, so we paid the fee up front, and then we get it back over a payroll deduction from the associates, and then the executive director is using some of her wellness money to provide free yoga classes and provide cash incentives for people who stick with the program for 3 months or more. So there's a lot of really creative things going on. But we definitely give everybody some money to play with to try some different things and then hopefully share best practices.
One more nosy question. Are all your campuses smoke-free?
Gosh, I believe they are, yeah.
I know you can't smoke in buildings, but, but can they smoke on the campus?
Well, we've generally, I think we do for residents have, a small smoking area. So I think we've gone smoke-free.
Just an issue we're wrestling with right now, trying to figure it out.
We've actually have converted a couple of communities to be smoke-free, but that would be our goal. It's really, we have very few people, I think, that smoke anymore. But I think the next generation of residents probably will not smoke, but.
Okay. Others, thoughts
I think
on
the
this?
last 4 people in America that smoke actually work at one of my properties.
Oh, no, I've still got some.
Usually out by the dumpster. But yeah, we have not gone smoke-free.
If that day occurs, that's when you'll see healthcare costs go down in this country. So.
Yeah, but we've not gone smoke-free on the campuses yet on all of our properties. But those are really neat programs. I'm excited to hear the things Marilyn's doing. Those are really neat, proactive benefits for the associates. But we elected to grandfather with our health plan. We're not self-insured. We're with one of those people that have the color associated with their name. But we've elected to grandfather. There's just a lot of pressure and consideration depending on the size of company and size of group that you have, whether to stay in and provide benefits or not. And that's just a real challenge for many operators to decide whether it's beneficial to opt out and not provide health insurance at all. And I hope that the program continues to be refined and the rules continue to be refined so we can all afford to do that. But we've had for many years the dual tiered health benefit program, one premium type of a package and one that's a less expensive and less coverage in order for the associates to be able to afford it. But I think as many as the no exclusions begin to come into the coverage, and some companies have begun to include that now. that will kind of level a playing field between the two-tiered health programs and hopefully make it more affordable for everybody.